everyone, I am Dr. Chirag, Consultant Interventional Cardiologist at Aster Whitefield Hospital. Today, let's discuss about Transcatheter Aortic Valve Implantation, which is otherwise known as TAVI or TAVR. So TAVI or TAVR is a percutaneous procedure for the treatment of severe aortic stenosis. Aortic stenosis is a condition wherein the aortic valve, which is an important valve that regulates the blood supply from the heart to the rest of the body, gets degenerated. As a result of this degenerative process, undergoes significant narrowing. The typical symptoms of aortic stenosis include exertional chest pain, exertional breathlessness, and fainting, which is otherwise known as syncope. So aortic stenosis is diagnosed with clinical symptoms and echo. Echo helps us to also classify aortic stenosis as mild, moderate, and severe. Severe aortic stenosis needs treatment with implantation of a new prosthetic valve. Typically, the treatment of aortic stenosis involved an open heart surgery wherein the deceased valve would be replaced with a new prosthetic valve. But the major challenge was that aortic stenosis involves elderly people who are otherwise having a lot of other comorbidities, and also they are frail and are in poor general condition. So most of these patients would be in prohibitive surgical risk, making the surgical aortic valve replacement a high risk procedure. So over a period of time, transcatheter aortic valve implantation, also known as TAVI, was invented. This was invented almost like 15 years back and has gone constant upgradation with a significant improvement in technology. Transcatheter aortic valve implantation or TAVI is a percutaneous procedure in which a small catheter is inserted through a hole, typically from the groin. Through this catheter, a new valve is positioned inside the old deceased valve, and this new valve is expanded, displacing the old valve. As a result, the new valve takes over the function and the heart starts pumping blood effectively, thus relieving the patient of symptoms of aortic stenosis. So what is the advantage of TAVI over the conventional open heart surgery is that this procedure is a percutaneous procedure done through a very small hole in the groin. This involves only a local anesthesia and sedation and doesn't need general anesthesia. These elderly patients with aortic stenosis will have a quicker recovery and a short time to discharge, with an average time to discharge of around 2 to 3 days. And any need for post-operative rehabilitation and other necessary steps will be less, because this is not an open surgical procedure but a percutaneous procedure which helps these patients come back to their regular activities very quickly. At Aster Whitefield Hospital, we are one of the center of excellence for treatment of aortic stenosis, and TAVI has been our go-to strategy in treating aortic stenosis in elderly patients with severe aortic stenosis. Thank you.